Welcome to the Dynamic Cardiology Station. This skill is designed to evaluate your ability to recognize and treat cardiac arrhythmias in accordance with current AHA guidelines and algorithms. In this part, you will be evaluated utilizing the defibrillation mannequin and ECG monitor defibrillator. 4 separate arrhythmias will be presented in which you must act as the team leader and voice your interpretation of each arrhythmia, as well as all basic and advanced life support and pharmacological interventions you wish to administer. You must physically demonstrate and actually perform all electrical interventions necessary throughout this skill. Please leave the defibrillator turned down to its lowest energy setting and verbally state the energy level you would be delivering to the patient prior to shocking the mannequin. Just as it sometimes occurs in the field, some patients do not respond favorably despite appropriate interpretation and treatment. The patient's response in these prepared scenarios is not meant to give any indication whatsoever as to your performance in this skill. Please take a few moments to familiarize yourself with the equipment before we begin, and I will be happy to explain any of the specific operational features of the monitor defibrillator. Okay. You will have 8 minutes to complete the skill once we begin. I may ask questions for clarification and will acknowledge the verbal treatments you indicate are necessary. Do you have any questions? Okay. And your time starts. You are called to a private residence for a 50-year-old male complaining of chest pain and trouble breathing.
All right. So I arrive on scene. First of all, scene safe, appropriate PPE. So I'm going to introduce myself and say, hello, sir, my name is Nate. Is he answering me appropriately?
He is.
Okay. So I'm going to go ahead real quick. I'm with the ambulance. We're going to do a couple things real quick. We're going to double check your vitals. What's going on today? You having any pain anywhere?
I'm having some pain in my chest and I feel short of breath.
Pain in the chest, short of breath. Okay. So real quick, I'm going to go ahead and get my monitor. I would establish, get a blood pressure, SpO2, and I would attach my 4 lead cables and identify 93%. So I would go ahead and get him on 2 liters per minute right now via nasal cannula,
Okay.
help him with his O2 set. I get the 4 lead on, I would identify the rhythm. So right now, it looks like we have a 3rd degree heart block. So at this time, with his blood pressure being low, he's hemodynamically unstable, I would consider atropine and pharmacological intervention. But at this time, I'm going to attach the pads and attempt to pace this rhythm. With that, I could also establish an IV real quick,
Okay.
and consider any pain management, analgesic, or sedation. I'll go ahead, attach my pads. All right, I'm going to go ahead and plug in my pads to my monitor. All right, I notice a rhythm change on the monitor. Do I have a pulse?
You do not?
Do not. Okay. So at this time, looks like I have VFib on the monitor. So we go ahead and start CPR, start assisting ventilations, consider a oral adjunct such as an OPA.
Okay.
I would go ahead and now defibrillate this rhythm. It was a witness cardiac arrest. So I would go ahead and select my energy setting. My energy setting is going to be 200 joules. For this scenario, I'm going to set it to low 10 joules.
Okay.
I would go ahead and charge up my monitor, make sure everybody's clear, make sure we're clear, and then I would go ahead and defibrillate the patient. So we've gone in defibrillated. Do I notice any rhythm change? Do I have a pulse?
You do not.
Okay, so it looks like I have asystole on the monitor. I'm going to go ahead and continue CPR, bagging the patient. I would consider the use of a more advanced airway, such as an iGel or an ET tube. I would have my IV established. We would administer 1 milligram epi every 3 to 5 minutes, so we'll go ahead and give epi right now.
Okay.
And we will continue CPR, bagging the patient, reassessing. We would have capnography on to monitor end-tidal CO2.
Okay.
Continue that, wait about another 3-4 minutes, and we would do another epi, we could also do another pulse and rhythm check after 2 minutes of CPR. So 2 minutes of CPR has been done. Do I notice a pulse or any other rhythm? So it looks like I still have no pulse and asystole on the monitor. So we would go ahead and continue with CPR, bagging the patient. If 3 minutes has gone by, we would go ahead and administer another milligram of epi
Okay,
via
3
IV.
minutes.
All right, so I would go ahead and administer epi, 1 milligram via IV. Would do my med check with my partner and continue our CPR and asystole algorithm.
Okay.
All right. So I'm continuing CPR, continuing bagging. I have good compliance with the bag.
You do?
Okay. All right. So I notice a rhythm change on the monitor. Looks like could be ROSC. Do I have a pulse?
You do have a pulse.
Okay. And what's my end tidal?
Your intel is now 60.
Now 60. Okay. So I have a return of spontaneous circulation. I have a spike in end tidal. I have rhythm change. At this time, I'm going to go ahead and reassess. I'm going to hang fluids. And I could also consider atropine or epi, push dose epi to help this heart rate. We would move the patient to the cot and into the truck and transport to the nearest most appropriate facility.
Okay. Is there anything else you'd like to do for this patient?
No, sir.
Okay, we're done.
All right, thank you.